Welcome to the Being in Medicine show. I'm Corey Anderson.
And I'm Jeff Mars.
Together we aim to revolutionize the healthcare experience for patients, clinicians, and all team members by unlocking the transformative power of human potential.
Each week, we explore with you and our guests how embracing our authentic selves and choosing who we are being can affect the nature of healing, leading to profound transformations in our lives and in the lives of those around us.
Join us today on a journey through self-discovery and empowerment as we unlock the human potential within each of us. Welcome back to the Being in Medicine show. We're super excited to have Dr. Carla Rotering with us today. We are so happy that she joined us and willing to have this conversation. And let me tell you a little bit about her, because she is a distinguished pulmonary and critical care physician whose career is marked by a profound commitment to the growth and upliftment of individuals and organizations. As a leader, mentor, facilitator, and coach, Carla is dedicated to helping people realize their fullest potential, both professionally and personally. Her approach combines experiential and introspective processes delivered with enthusiasm, care, wisdom, and humor. With a deep appreciation for the transformative power of coaching and mentoring, Carla empowers individuals to strive for excellence, integrity, and collaboration. Her work has not only shaped the lives of countless healthcare professionals, but has also contributed to the evolution of human potential across various fields. In her previous role as Chief of Staff at Banner Thunderbird Medical Center in Phoenix, Carla has demonstrated exceptional leadership and commitment to professional well-being. As the founder of Night Skies and Boxcar International and co-founder of the Our Future Selves and Everything Under the Sun retreat series, she has created platforms for healthcare professionals and women to explore resilience and purpose. Her extensive experience in physician leadership development, healthcare communication, and wellness has earned her numerous accolades, including the Phoenix Business Journal's Healthcare Heroes Lifetime Achievement Award in 2019. With a medical degree from the University of North Dakota and a master's degree in spiritual psychology from the University of Santa Monica, Carla's expertise is complemented by her certifications in leadership development and professional coaching. Her visionary leadership and dedication to service excellence continues to inspire and transform the healthcare landscape. Welcome, Dr. Carla Rotering. Thank you for being here.
Welcome.
Thank you so much for having me.
We are happy to have you and excited for you to join us today. And we've just listed a bunch of accolades for you, and you are highly accomplished in all areas of your professional life. And being, a powerful leader in your hospital, from being a well-respected physician to, having financial abundance and all the things in your life. But that's not the end of your story. That's not where it stopped for you. Tell us a little bit about the transformation that you've had in medicine in your career and what got you to where you are today.
So I think I did what many people did when they sort of flag and started their professional work. I overextended, I overgave, I was overly responsible for everything.
Yeah.
I worked an average of 340 days a year.
Wow.
And and I was a single mom.
Yeah. Wow.
And really, in order to do that, you have to unconsciously but distinctly separate from the self that you are.
Right.
You have to separate from the feelings that come forward. You have to separate from the physical fatigue that emerges. You have to separate from the inner voice that is attempting to get your attention.
Yeah.
Right. So that you can keep the commitment that you made in some silent place that you thought meant something.
Right. Absolutely. So go ahead, continue.
So I did all of that, and I did it fiercely, and I felt pretty noble about it.
Yeah.
Like nobody cared more, nobody worked harder,
Right.
all that stuff. And
Yeah.
I've told this story before, but it is sort of a sentinel story for me. So I was in the ICU one day in critical care, and there was a young man in his early 50s who coded off and on all day long.
Mm,
And it was chaotic and it was heightened, and we worked really hard and we did really good work. And at the end of the day, he was stable.
sure.
And so we sat down and, the little stools we have in the ICU and started to chart. And there was a nurse, I'll never forget her. Her name was Marissa. And
Yeah.
she was sitting next to me. And I said to her kind of casually, um, I don't think we've ever talked to each other as much as we have today. And I've known you for a couple of years. And she swung her little stool around and got her knees right up on my knees and looked me straight in the eye. And she said, "That's because you scare the hell out of everyone."
Oh, wow.
And I kind of looked over my shoulder, like, who could she possibly be talking to?
Right.
Right. And I
Yeah.
was like, I could feel all the argument rise
Yeah.
up. And I was like ready to roll up my sleeves and rumble
Right.
with her, which I was very good at, and which is exactly what she was pointing to.
Right.
And something inside of me softened
Yeah.
and heard her. And I remember sort of collapsing into what I now call relief that she was telling me the truth.
Mm,
Yeah. And so I really kind of set about looking for, seeking, recognizing, I had no clue what to do, right?
yeah.
And found my way to the University of Santa Monica and to a Caribbean island all in the same month. And I really credit both of those things with giving me enough altitude and space and safety and beauty and loving and a new understanding to move forward in a different way and still do what I love to do.
Right. Yeah, absolutely. That is yeah, definitely a sentinel event and story in your life
Yeah.
for sure. And you shortened it a little bit in the fact that she sparked some awareness for you,
Oh, yeah.
right? And that led you to the University of Santa Monica. But that period of time between the awareness and that, what was that journey like? Tell us a little bit about that for you.
Yeah. So it's a little bit like being an existential free fall,
Okay.
right?
Yeah.
Like my way of being was clearly no longer aligned with what really resided in my heart when I walked through the doors of my medical school,
Yeah.
right? Like I was a heart-centered student who knew I had to learn some science if I wanted to do what I wanted to do,
Yeah.
right?
Absolutely.
So if that were no longer going to work for me, and if everything that I had put into creating that image of myself and that way of being for myself went away, I wasn't certain what would be left,
Oh,
right? So I mean, it's a lot of work to maintain that kind of presence in any workspace,
right.
right?
Absolutely.
The sort of bully, authority, demanding, and anything that I applied outside of myself, I also applied inside of myself,
Yeah.
right? So I had that same conversation with that same bully, with the same authority, with
Right. Yeah.
I knew what it felt like to talk
You
to
knew that
me.
person. Yeah. You had
Yeah,
experienced it.
yeah.
Yeah.
Uh, and the first glimmer that I could look in a different direction.
Mm,
That I didn't have to believe everything I thought I needed to do to survive in this world of
yeah.
medicine. And, we're talking almost 40 years ago. So that was a sort of an unusual um, place for me to occupy in terms of medical specialties and gender and those
Right.
kinds of things. So I really thought that I needed to, if you're going to be tough, I will be tougher.
Yeah, you had to harden yourself.
Yeah, or at least that's what I thought. And
Yeah,
maybe,
what you
maybe
thought.
back then I did. I don't know. But
Yeah,
what I do know is that there
that's how
was
it occurred
this
to you.
gap between what I thought I needed to be and I have no idea.
Yeah,
Like I have no idea. I don't even remember quite who I was when I came here.
right.
Yeah.
Yeah. Yeah, and you mentioned being a heart-centered student, right? And you knew you had to
Mhm.
learn some science. And you chose on, it occurred to you to take on at the time this way of being that people were interacting with, right? This is not, I don't believe, an uncommon story for many people in the healthcare space, this particular thing that you described. I know I see it. How do you see it now, looking back and doing what you do now with coaching and working with health professionals? Do you still find people living in that space of what you experienced? What do you see in that space?
So you know that there are people who live in that space that I
Oh, absolutely.
experienced. Yeah,
Yeah,
absolutely. Um, uh, are the are the notions of the external details different?
yeah,
Maybe, because things are substantially different in terms of the design of our daily life inside the hospital walls or inside clinics or wherever we may, pick up our stuff and go to work.
right.
There, and yet there continues to be, the burnout rates,
Yeah,
even among people who are in training and among medical students. Some of it is, some of what we see is generational. There's a distinction between the kind of disturbance that people are experiencing.
yeah,
There's an interesting difference between um, how people feel about the ancient tradition of the work, the nobility of the work,
yeah,
um, whether it's really held in a space of noble work, or whether it's just our work.
right.
Yeah.
Yeah, there's definitely been a transition in
Hmm.
that
Yeah.
understanding and that experience. Absolutely. Yeah. Jeff, how do you encounter that in your space and with those that you interact with?
There's a term that we use called indoctrination, partly because it's a pun. And I had the same experience of how I became indoctrinated into medicine and similarly required a conscious intention to get back to who I truly am at my core. And I do have that experience that people sometimes show up being who they think they're supposed to be and not who they truly are. So I relate to that.
Yeah. When you discovered that for yourself, Carla, how did what began to unfold for you? Tell the audience, like, man, when you became aware of what this ICU nurse kind of thrust onto you and you started to do that work, what started to transform for you or in medicine or in your life? Just give us some insight.
Well, I didn't get knocked off a donkey. you know,
Yeah,
I didn't have an epiphany one afternoon and wake up the next morning.
right.
I still had a lot of resistance to any notion that I had any dominion over this. So
That's
even
great.
though I could acknowledge like there was something really soft and really humble inside of me that really acknowledged not only that she was telling me the truth,
Yeah,
but that I had lost my way.
yeah,
Um, uh, Even though that resonated for me, I still had a lot of resistance around any idea that I
mhm,
could show up in any other way. In fact, I really thought that I would have to leave medicine,
yeah.
or just simply continue the way I was and die young.
Right. Yeah. You could not see yourself bringing those things into alignment at that time, which is what people still continue to experience. And
Yeah,
you were able to do that
yeah.
and thrive because of that. How did
Mhm.
those relationships with patients, with staff, with colleagues emerge after doing some of this work and starting to align who you wanted to be and who you were? And tell us a little bit about that.
Yeah. You know, the first part of the process really had to be um, to have compassion
Yeah.
for the evolution that had occurred without my noticing
Right.
and recognizing what drove that. Because underneath all of that was still, you know, that pure heart that I took to the work in the first place,
Yeah.
was still that longing to be of service, to make a difference, to
Yeah.
be a healer on all levels of our being as human beings.
Yeah.
So it was still there. So to really see through the eyes of tenderness, compassion, and forgiveness,
Yeah.
um, uh, how I almost innocently lost my way.
Yeah.
And from that place, then you can begin to sort of ask yourself, given what's going on, because this is a Steve kind of question, a Steve Hardison kind of question, you know, given what's going on, what would I like to create,
Yeah.
including my way of being?
Right.
So, so everything shifted. Now I had the great privilege of being really, really embraced by the staff at the hospital for whatever reason, because I was pretty cranky.
Yeah.
Um, uh, they just loved me
Yeah.
and they took really, really good care of me. So small things began to happen, like I would stay late. And at 10 o'clock at night, when you know, when people were sleeping, we would have 15-minute conversations, all of the nurses and the respiratory therapists and whoever was around, about really and small sound bites of personal transformation. The things that I was learning at the University of Santa Monica about spiritual psychology, about consciousness, about an inside out rather than an outside in way of being,
Yeah.
you know, of seeing through the eyes of love, of all of the things that I was learning. We would have these little 10 to 15-minute conversations at nurses' stations for the next year.
Wow.
Right? So there,
That's,
and they say, you know, if you teach something that you're learning,
mm-hmm.
it finds a space to take hold a little earlier
Yeah.
and all that stuff, you know.
Right.
So yeah. And then I think one of the biggest changes for me for patients was that I no longer felt culpable with
Oh,
patients,
yeah.
right?
Yeah. Absolutely.
Yeah, yeah. That um I felt empathic. I showed up and did the best work I could muster up on every given day. I took my heart and my brain to
Yeah.
work. Um, but if, you know, if someone died, it wasn't my fault. I didn't collapse. I could interface with a family from a very helpful place because I wasn't there with apology,
Yeah.
right?
Absolutely.
I could allow patients the dignity of their own choice. So if I had a patient in the clinic who was a 40-year smoker and said, I know you're going to talk to me about cigarettes, you know, and I
Yeah.
would say, you know, I'm not finger wagging and it's always going to come up. And I'm always going to listen to what you have to say to me about that. And I'm always going to honor your process. And I'm
Right.
always going to advise you to quit. You know,
Yeah.
yeah,
I love that. Yeah. Having them the dignity of their choice.
yeah.
That's brilliant. I really appreciate that. Jeff, where are you at on all of this? What questions come up for you?
Oh, I already raised so many questions in my mind. And you already answered the first question, I think, about what you meant when you showed up to school as a heart-centered student. I think you answered that one. Now I'm curious in the process of becoming, as you have these conversations at nursing stations late in the evening, did you start to see things that were already there that maybe hadn't had been somewhat opaque?
Yeah. The first thing for me, Jeff, probably was the this awareness that I wasn't the only one who cared.
Hmm.
That I wasn't the person who was showing up and saving the day. That the people that I worked with had this incredible devotion, right?
Mm-hmm.
This incredible discipline to just be there through it all, way
Yeah.
more than I ever was, right?
Hmm.
To do the hard work. They also demonstrated a teamwork to me that I hadn't been aware of before, right?
Absolutely. Right.
And the other thing that I noticed, so that was so powerful for me to recognize, right? To really acknowledge that every single person around me was in that space for the very same reasons that I had been called to that work in the first place, that we were all there for the
Yeah.
same thing.
Right.
Yeah. The other thing that I noticed that came kind of as a surprise and really showed up as an inquiry in my mind was that they had each other.
Hmm.
Nursing staff, respiratory therapists, they had managed to create a community of caring with each other.
Yeah.
And they knew that they could trust one another in moments of profound grief, in moments of celebration. They knew that they had each other's backs. And I wondered why we didn't.
Oh,
Hmm.
that's what did you discover?
Well, I think I'm still trying to discover that, but I do think that some of it is, the ancient beliefs that we have about what is required of you to sacrifice to be a physician or to be a provider,
Yeah.
right? And that if your badge of suffering is big enough, right, then you will be more highly regarded.
Hmm.
And that to demonstrate um, any kind of softness or emotional crack or a need for someone to just be with you,
Right.
that suggested, and perhaps because of my gender back then also, I'm not sure about that, but i
Yeah.
thought i thought that to be true. um any simple request like that was looked at with suspicion, as though we weren't made of the right stuff.
Hmm.
Yeah, especially inside the hospital walls. There's some study, and it's old, so it may not be accurate anymore, but there was a study 15 years ago that the Crucial Conversations folks did, um, about silence and how silence kills in medicine. But one of the things that I'll never forget about that study is that they said that people who had been sued for malpractice were approached by less than 1% of their peers who were aware that they were going through a malpractice suit.
Hmm. Right.
Wow. Yeah.
Yeah.
Yeah. So, yeah, that's fascinating. That's fascinating. I love the discoveries, because we're still, as you said, still learning, still grappling with these same things that are going on inside the hospital, right? That community of care, where are we participating as providers and where are we not participating? And how is that showing up for us? And how is that impacting the care that we provide and the people that we serve? And so thank you for sharing that. When you stepped into this space of creating awareness and going to the University of Santa Monica and kind of looking at this learning, the spiritual psychology aspect, timeline wise, was that before you became the chief of staff or after?
It was wow.
Wow.
Oh, wow.
So, how I acknowledge you for that work. That's a brilliant.
Yeah.
How did you carry that into that role? How did that go?
It's interesting. I mean, so how do I say this? The formal medical staff structure really can be implemented without a person, right?
Yeah.
So really getting the agenda out of the way, the things that you have to do for regulatory purposes to meet those requirements. So the real role, if we choose to take it, many people just aren't interested in this aspect of it, although I think things are shifting. And I do think things are shifting, by the way. And so the really interesting piece of it for me that I recognized was that the majority of the things that I had to deal with had to do with my peers and their bad behavior.
Right.
So what brought them to the attention of somebody that would send them to the chief of staff? And as I did this really deep work and really explored not only my own humanity, but how I could bring that into my work with patients, but also with my peers.
Yeah.
I began to see things differently. And so I less and less operated out of the disciplinary paradigm that has been traditionally set up as part of that organized medical staff structure.
Yeah.
And really begin to enter the heart of service.
That's brilliant.
Right?
Yeah.
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 So it was the perfect place for me then.
Yeah. So you had yourself showing up in a way which you were in service of them rather than being disciplined for them. Yeah. How did they react to that?
They cried.
They cried.
I would say 50% of the doctors that I met with the first time that I met with them under those circumstances cried.
Yeah.
Wow.
What was it about that? I mean, obviously it was the way that you were being with them, but was it, do you think, a sense of them being heard, being listened to, being shown compassion in a space where there really wasn't previously? Was that that?
Yeah, I don't know that I could have said it better. It was safe, first of all.
Yeah, safe.
So the first thing that I did was promise them that whatever unfolded between us would stay between us unless I thought they were a danger in the hospital.
Yeah.
To themselves or others. Otherwise, and I announced that. I said, I will let you know that I meet with people, but I won't tell you what we talked about unless I think it's dangerous. And nobody quite knew what to do with that, but nobody quite knew what to do with me a lot of the time anyway. So, and the other thing was that we have this, we live in a blame and shame culture a good part of the time.
Yes.
To be summoned to the chief of staff. I mean, people walked in the door with their defenses up, angry, victim-based, or, with heads hung low.
Yes.
Willing to grovel. To do anything. And so I don't know exactly what that says about our profession, but to have something that wasn't either one of those spaces, to
Yeah.
just be able to come and know that they were in the presence of people who wanted to help,
Right.
who walked their walk,
Yeah.
who could relate, who knew how they got there,
Right.
you know. That's
Absolutely.
mhm.
Yeah. Creating a safe space for them to be vulnerable and to share, but to feel supported and to feel heard. I want to acknowledge you for the work that you did on that, because
It's
that's
amazing.
amazing. Yeah,
Yeah,
it really
thanks.
is. Yeah.
Curious, when you have two hypothetical situations, the blame and shame medical staff organization versus the heart of service organization, and I think the answer is obvious, but I'd like to hear from you. What kind of difference in outcomes did you see as far as improving actual performance?
So it's unfortunate that I didn't measure. So anything that I tell you is anecdotal. But for instance, we had a cardiologist who, I mean, his complication rate doing caths was so high, you know, and I don't know his statistics,
Hmm.
but I remember him saying, you know, I hardly ever have a complication anymore when I do my work. But I think that, you know, there's a common sense aspect of this that basically says, you know, if we are not in disturbance, if we are not in a constant argument, walking down every hallway of every minute of every day with invisible entities or the people we just left, or you know, our spouse at home, or
Yeah.
whatever is going on, you know, if we are actually in a collegial team that knows they can count on and trust each other, and you may have more of that in surgery than we had in other places in the hospital, um, then the quality of the care that we deliver, both from a science standpoint, um, but also from a presence standpoint, it elevates. And to suggest that our presence and our caring isn't just as medicinal as some of the other therapeutic interventions that we
Yeah.
employ would be a mistake.
Hmm, right.
Absolutely. Yeah. We have to reserve space for all of that healing to occur in all those ways. Yeah.
Yeah.
What was so those folks that came into your office to have those conversations, you know, cried, they felt listened to. What was the experience of those who didn't come into your office? What did they see a transformation of those colleagues around them, or was that felt in any particular way in your hospital?
Yeah. Yeah, I think so. I mean,
Yeah.
again, we tend to be very guarded around tender conversations,
Yeah.
right?
Right.
We tend to be very careful about saying that we noticed
Yeah.
something good.
Right.
Right. Absolutely.
Uh, I remember an orthopedic surgeon saying to me, I don't know what you're doing, but my wife needs it.
Wow.
Yeah.
And that was so, I mean, my heart was so warmed by hearing him
Right.
say that, because I knew that there was something beyond my wife needs it, that
Hmm,
he was acknowledging in the best way that he could tap into, you
Yeah.
know? Yeah.
Yeah. He
Yeah.
was acknowledging you for that. Yeah. For the
Yeah.
work. Yeah. Wow.
hmm.
Tell us a little bit from an administrative perspective. How, did the administrators see, or what did they glean from this
Mm,
experience?
mm.
Tell us from that standpoint.
So, you know, I have there was a woman who was the CEO of the hospital
Yeah.
before I, before I discovered I was a bully.
Hmm.
Yeah.
And, but I was vice chief at that point,
Sure.
right? And she is still a friend of mine. And she said to me, I remember I would see you walking down the hall and I think, oh God, I don't know if I have the energy for that today.
Oh, yeah.
Right.
Right. Yeah.
And she now, you know, I mean, she said, I hardly remember, I can hardly believe that that was you,
Yeah.
right? But it was. I
Mhm.
can hardly, I can hardly, so I don't know exactly, but I was in that program for about 2 years. And at the end of the 2 years, I actually left the chief of staff position and created a professional well-being um, committee that I did both in our hospital and then did some regional work for Banner as well in that area, and I continue to work. But
Yeah.
but I really like it was just so clear to me that the next place to for me to bring my caring and healership was to my peers.
Right. How was that received by them in those other spaces?
Well, I think just as you would expect, I think that
Yeah.
there's a pocket of people who are dying of thirst, you
Yeah.
know, to have this kind of presence and opportunity and place to go,
Yeah.
to have the kind of conversations um, that you would sort of listen to but not appear to be engaged in
Right.
previously.
Yeah.
You know, there was a real interest in a small pocket of people,
Yeah.
right? And that grew over time, and I think it continues to grow over time. You know, I don't think there's any accident that the Joint Commission mandated professional health committees,
Right.
right? I don't think there's any accident that the AMA and many other organizations have really brought attention to the well-being of the healthcare workforce.
Yeah.
Look, we carry in our presence, in our bodies and in our emotions and in our thinking and the spirit of us, that's what we take to the bedside,
Absolutely.
right?
Yeah.
That's what we take to the bedside. And, you know, the question of how that contaminates our best efforts, and this goes back a little bit to, how, you know, how did it impact performance? You know, to have our to have all of those levels sort of infiltrated by something that was less than present,
Yeah.
we'll never know. We'll
Right.
never know the difference that that made. But I promise you, it makes a difference. And then, you know, I'm of the age, and maybe all of us have had a family member or someone um, find themselves at the mercy of a seemingly uncaring physician or a controlling nurse,
Yeah.
or you know, and that's enough revelation for us to consider, how am I showing up?
Absolutely. Yeah. How has that led into your current work that you do now with the retreats and the leadership? How does that roll into what you do now?
Well, almost everyone who so I do some retreats that are just for women and not just women in medicine.
Sure.
Right. And those retreats are almost always pointed towards what women do,
Sure.
right? That
Yeah.
seems um and it's and please know that I have no, like, I am not in competition with men. I think that there are circumstances that are sort of, again, invisibly present in the demands made on men that are distinctly different than the demands made on women, but they're not more than or less than. I just happen to be a woman and I know this, right?
Right.
So, I mean, that's my lived experience. So I speak
Yeah.
from my lived experience, right?
Absolutely.
But so, and I would say that about half the women who are interested in that are from medicine.
Sure.
I have had an equal number of male and female participants in retreat works, and the we I do, for instance, I do one retreat with a academic family practitioner from North Carolina,
Sure.
and we do this work called Our Future Selves, and it's really not for people who are utterly burned out.
Yeah.
It's really for people who are sort of mid-career and say, I worked really, really hard to get here, and is this it?
Right. Yeah.
Like,
Yeah.
is that all there is? And so to really now to be able to grow in consciousness, to grow in understanding, to add dimension, to add to add deeper understandings, all that stuff. Really, people call it meaning and purpose,
Yep.
right?
Mm.
Those are the buzzwords that we use, and they're good words.
Yeah.
But to really like how to discover that, does that still reside somewhere inside you? Can
Yeah.
you excavate that over the course of a weekend so that you can make good use of it?
Yeah.
Right. And people are I remember one of the retreats that we had early on, and we did it in an Airbnb. We keep these very small, 15 people or less, because they're intimate that way,
Yes.
and you create safety that way. And so we started like on a Thursday night and did a Friday, Saturday, half of Sunday retreat. Thursday night, we had dinner, we had a little bit of introduction. I mean, we had a little introduction, then we sent them off for dinner in an Airbnb. So there were several places to kind of gather, and
Yeah.
not all these people knew each other. And I would say within 20 minutes, this little house just rang with laughter.
Right.
And one of the physicians said to me, I can't remember the last time I laughed like this.
Yeah.
But there was this instant community, this
Yeah.
instant coming together around a shared life experience.
Right.
Yeah. Yeah.
Absolutely.
Hmm.
If you were to take all of your experience and all of the work that you've done and to give advice to those folks, those new providers or this people be entering into medicine, what advice would you give them?
Mm. Mm. Well, I think some of the things that we pointed to, right?
Sure.
Which is to place yourself at the center of your own caring
Yeah.
so that you can serve.
That's brilliant.
Take good care of yourself, and nurturing is not the same as numbing,
Yeah.
right?
Yeah.
To create relationships that you can trust, where
Yeah.
you can go, right, to be revealed, to
Yeah.
be raw, to be opened, and to allow the what you have experienced to be healed,
Yeah.
right? Um, I happen to be an advocate of contemplative practices. Do I meditate for an hour every morning? No, I do not. Right?
Yeah.
But I have a morning ritual that includes something that I wrote about why I show up to do this work every day
Mhm. That's amazing.
and what it means to me.
Right.
Right? So I think having community,
Yeah.
I think taking good care of ourselves, and then Listen to what people tell you. When they say to you, you look tired, you should go home, you should probably go home.
Great advice. That's great.
Yeah. Okay.
Yeah. Wow. There's so much gold in all of that. Jeff, what comes up for you around that advice?
About that advice, I actually had a question. If I could go back a moment,
Sure.
Corey and I have a mindset around powerful ways of being and how they create an enhanced outcome.
Yeah.
And what occurred to me when what you were saying a while ago is that our non-powerful ways of being show up, and even if all of the procedures and the therapeutics are done by the T and cannot even be criticized, still showing up from a non-powerful way of being likely has a nocebo or negative effect on an outcome.
Mm-hmm.
Mm-hmm.
Question I had for you, the Corey asked a great question. Someone entering a career of medicine, what advice would you give? Take it back even further. Kids these days, young people these days, as they're looking at the future ahead of them and the uncertainty of healthcare and healthcare reimbursements of things of that nature, what advice would you give to somebody who's even contemplating, should I go into field of medicine?
Yeah. Yeah.
Great question.
I don't like your question very much. Because it's a hard question to answer.
Yeah.
And it's not different than when we made that decision, I don't think. Because there was still, although although I will say this, that we're more aware that medicine's not exactly a hayride. We're more aware that there are regulatory obligations and external factors that impact our agency over the way we spend our day in a way that's different than it was when we were starting, right? Having said that, I have a granddaughter who's 24 who's made a decision not to go to medical school, but to go to PA school.
Yeah.
Instead. And her discernment was very interesting to me. She is absolutely heart-centered, right? She has a calling inside of her to be of service in the field of medicine that she can't deny. Right?
Yeah.
She loves science. She is a single mom, so she also has this practical consideration.
Absolutely.
She's worked with physicians for several years, and she said, I just don't think I want to do that.
Right.
Right? Like, that's too much for me to have on offer for what I'm going to get. And I can get the same kind of gratification doing what I'm doing. Now, that happens to be true for my granddaughter as she sees it at the wise old age of 24. And I don't know if that'll hold or not for her. And I don't know where life will take her and what it will show her.
Absolutely.
But I think the considerations are always what they were. What are the practical considerations? How will this impact my life? Right? And we primarily thought, I'll have power, I'll have money, I'll have social standing. But those things aren't quite as available as they were before. Look, everybody's going to make a living in medicine, right? But there is a different kind of esteem for physicians these days than there was, when I started. So it's really about you can't lean into medicine being pushed by your ego.
That's great.
Brilliant.
Yeah. Jeff and I have we talk about this on this show. E equals MC squared. Our experience equals our mission times compassion times competence, right? And I think this is where our experience in medicine really does have to be, show up through our mission, our purpose, what's calling us to serve, right? And then recognizing that you do have dominion over your experience through who you're being. in how you
Yes.
choose to create that, right? So even those folks who are choosing to go into medicine, yeah, it doesn't look the same as it used to, but it still can be fulfilling, and you can create that experience in a way in which serves you. And so I think there's still a lot of value there.
Right.
Yeah.
I love what the two of you are up to. I have to tell you, I've looked at everything I could get my hands on. I have such incredible admiration for the work that you're doing, but also it takes some courage to step forward in a new way when you've established yourself in a fairly conventional medical community. So I just want to thank you
Oh, well, thank you.
for the
I
work that you're doing.
really
I'm so
appreciate
grateful.
that. Thank you for that. And I want to acknowledge you. This has been just an amazing conversation. Your depth of knowledge and experience is just so valuable. And I want to acknowledge you for all the work that you've done to transform lives for yourself and for the people around you, because it is truly transforming medicine through how we're showing up and who we're being. So thank you as well.
Thanks.
Yeah.
Glad to
Jeff,
be
what
here.
else? What else is on your mind? I don't want to. We could spend hours and days talking to Carla
We could
about
do
this.
that
This has been
someday.
so wonderful. But what else? What else is on your mind, Jeff?
Well, the only other thing that came to my mind as we were speaking is I'm still captivated by that. As you started to unwind the indoctrination and get more complete and authentic to your core, and started the process of teaching, you started to experience things in the teams around you that had not been so evident,
Yeah.
like the support and the just as much dedication to medicine and serving that we as doctors might have. I'm curious what experience, and those are still the hands-on teams, taking
Yes.
x-rays, starting IVs, whatever, clearing airways. Curious from the administrative perspective. I feel that there tends to be these days a story of the us versus them mentality, providers versus administration. And does that same hold true? Are the people in administration also just people also coming from the right place? And should we as doctors be more open and compassionate towards them?
Of course. I mean, if it's true that we operate out of a paradigm that we create from the stories of our lives because we believe that they'll keep us safe,
Yeah.
because that we believe they show us the right way to live, then we not only get to have compassion for ourselves, but to recognize that we have a shared humanity, and every human being on the planet,
Right.
right,
Absolutely.
is operating out of the best paradigm that they could muster up at this point. So I will just tell you that maybe 10 years ago now, but I did this interesting medical executive committee retreat that included all of the members of the medical executive committee and all the C-suite members at the hospital, and that's a lot of people, right?
Yeah.
It's a big hospital. So, and one of the things that we did was we actually broke into our respective groups. We didn't mingle, and we spent a couple of hours saying, "Here's who we are. This is what we think about ourselves. Here's who they are.
Yeah.
This is what they think about ourselves. And this is what they think about us."
Oh yeah, brilliant.
Yeah. Yeah.
Absolutely.
And then,
That would shake the ground a little bit.
I have to tell you that if you create that experience in a way that is a little more lighthearted,
Yep.
Yeah.
right? Like we aren't taking all of this so seriously in
Yeah.
Sedona, that it really will allow people to lift.
Yeah.
right? And the surprises about the way that our groups saw each other in particular.
Right.
You know, we, the medical executive committee, were certain that they saw physicians as arrogant, as unapproachable, um, you know, and you have to assume that people were telling the truth,
Right.
right? And just
Yeah.
not trying to just please each other, because we're good
Right.
at that also. But, you know, that's not at all what they had to say. Right. So if you can find that shared pool
Yeah.
of caring, in the same way that I saw that my whole team was there with no less loving than I held. So if you can find that shared pool of caring where there is no less caring on the part of any of these entities,
Yeah.
It changes the conversation.
Love that.
It does.
Yeah.
Mm-hmm.
Thank you for that.
Yeah. Yeah. Wow. Could go on forever. So where can folks, the listeners, where can they find you, Dr. Rotering? Where would they go to learn more about you and the programs and the workshops that you have?
Yeah. So my website is drcarlarotering.com. Just that. And it has almost all of that stuff, and it's got ways to contact me. So
Sure.
I really welcome questions. Feel free to reach out if there's any way that I can be of service. I will tell you that I'm writing a book.
Oh,
So stay
fantastic.
tuned. I'm really
Yeah.
excited about this book. And I'll tell you that the book is called Bartering for Belonging.
Oh,
And it really has to do with there may not have been a better place for me to practice bartering for belonging than there was inside the profession of medicine.
yeah,
So,
absolutely.
yeah.
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 Well, I look forward to that book. That'll be a
Yeah.
fun one. Can't wait. Well, we appreciate you coming on and sharing all your wisdom. I want to acknowledge you again for the work that you've
Thanks.
done and the lives that you've transformed and the patients that you've served and the teams that you've served along the way, including the physicians in your hospitals and the world around you. So thank you for being here. Thank you for being a part of the conversation about being in medicine. And it was just a joy to have you on. So thank you.
Thank you so much. Take good care and let's connect soon.
Absolutely.
Thank you.
Thank you all. Thanks for listening. And thank you for another show of Being in Medicine.
Thank you for joining us today on the Being in Medicine show, where each week we open the transformative power of connecting our physical, emotional, mental, and spiritual nature to how we show up in medicine.
If you find this conversation valuable, please like, comment, and subscribe. And if you or someone you know has a story to share, contact us at beinginmedicine.com. See you next time.